This year we've had to adapt quite a lot to what we would normally be doing. The sheer volume of prescriptions that came through in early March, to having to change to a lot of the doctors were just doing telehealth. We didn't have any doctors that were doing face-to-face in Kalgoorlie. They were really worried about not having enough doctors in Kalgoorlie, so they wanted to protect themselves, but that meant that the burden actually fell on the pharmacies. So we had to really quickly create different systems to get prescriptions done as quickly as possible, because no one wanted to wait in store, and we're really mindful of that, especially because a lot of our customers are quite elderly and Indigenous, so they're two of the highest brackets of people that would be vulnerable to COVID.
We are in a small regional town in Western Australia. We don't have the type of issues that we're having in the eastern states. So, but certainly in terms of March, we're certainly looking down the barrel of a lot of people isolating. So we essentially segued into an emergency service, in which case we did a lot of deliveries to our patients who are deciding to self-isolate. So certainly we became more of a delivery service, maybe a more expanded delivery service as well, mainly from my perspective. So people who are out of town, I got in my car and I drove out to them. This was a time when pharmacy, could really show its benefits, and I think we did. And I think the other thing is it was really just staying accessible and communicating to our customers as well. I mean, there was a significant issue with supply of medicines, and I don't think that's improved. I think it's improved slightly, but there's definitely a lot of challenges there.
So we've had to improve our collaboration with our local healthcare professionals as we've all had to navigate the new world of telehealth. At the beginning of the pandemic, we saw a massive increase in the number of faxes and email prescriptions, and we had to change our workflow to adapt to this, and also the reconciliation of these prescriptions. Our Capital Chemist head office have been amazing during this period, and they've also really supported us, and they're part of our wider team, and they've helped with the implementation of new policies and procedures which we've had to adapt. And they've also really assisted us with our stock management, which has been critical as there's been strain on supply and increased demand. So particularly for things like masks, hand sanitizers, salbutamol inhalers. And so we're very thankful for all the support that we've received from them. We have also utilised our increased scope of practice, particularly the continued dispensing. And this has been really useful when we've had patients that have run out of their prescriptions, have come into us and they can't get into their usual doctor. And we've been able to provide them with ongoing supply for a month. And it's meant that they haven't gone without their medication, which has improved health outcomes. So this is something I hope will continue post the end of September.